This is BoomerLife on CL 650.
Hey, welcome back to CL 650. We're talking about getting a good night's sleep. And Dr. Charnel Muir is our regular guest here, the SnoreDentist, located in North Vancouver. SnoreDentist.ca is the best way to get in touch with Dr. Muir. And you are a dentist that specializes in fitting oral appliances.
That's right.
And you're one of only two in British Columbia, right?
Yeah, so currently one of two in private practice that are what are called diplomats in dental sleep medicine. So it's all I do in my practice. If you come into my practice, you can't have your teeth cleaned, or we won't check for cavities and any of that. You still maintain your general dentist. Mm-hmm. And we just treat patients for snoring and sleep apnea using oral appliances.
And our special guest today is Dr. John Remmers. Dr. Remmers is recognized physiologist, pioneer, and innovator in sleep medicine. As a world-renowned expert in the field of snoring and obstructive sleep apnea. He's published over 100 peer-reviewed articles and is based in Calgary. So welcome back to the show. So Dr. Remmers, how have things changed with getting people tested for snoring and sleep apnea? How was it years ago, and where are we today? And we have a big announcement about the next step and how it's going to change.
Yes, I think this provides some perspective to understand how we came to home testing. In the beginning, this was all done in the laboratory with wires and signals and all kinds of smoke and drums and mirrors in the hospital. No, seriously, overnight tests were very common, and you would do one full night test to make a diagnosis, and then the next night to start somebody on CPAP, and that was routine. Well, we knew in Calgary that we weren't going to be able to do that given how many people had sleep apnea, so we invented a new approach. It was to take a monitor into the home and just measure the snoring and the airflow and the oxygen by standard methods, and then make a clear interpretation. And we were the first to actually have a monitor in the home that gave answers that were just as good as this elaborate, expensive overnight test in the hospital. That was about 20 years ago. We deployed this new approach in Calgary, and over the past 20 years, the success has been just amazing. About 75 to 100 such monitors go out every night into people's homes, and we can both make a diagnosis, or we can see how they're doing on treatment, and do it all much more conveniently and inexpensively than if we were trying to do this, take care of this massive disease. I mean, 20% of the adult population has sleep apnea, and it is just crazy to think about doing these in-hospital tests on all of those people.
Well, having done the home sleep test, it took a while to fall asleep because you're wearing, something around your chest, and the hardest thing for me was the oxygen sensor on my finger. For some reason, I don't know. But so it took me a little longer to fall asleep than I typically would. I couldn't imagine how tough it would be to fall asleep in a lab with all of these things hooked up to you.
Exactly. And people feel actually threatened, particularly women alone in a hospital bedroom with somebody like a male technician sitting outside watching them sleep all night. That's really not much fun. And then often you're waiting for the aha moment when the technician comes bounding into your room and says, now, sir, we're going to put this mask over your nose and just breathe normally, but it's going to be pushing air down your throat, and don't worry about that, and just go right back to sleep for us.
Good luck with that. So the home sleep test has been very successful, and Dr. Muir everybody that comes to see you, you need to get this baseline information.
Yeah. So my practice follows current guidelines, which means I don't treat people unless they're actually diagnosed, so that I know what treatment that would be applicable to them. So the correct diagnosis is vitally important in proper practice guidelines, and people shouldn't be treated for just snoring. Until they have been shown to be just snoring. And that's a critical part, is you should take the monitor home. There's no charge for taking the monitor home out of my practice. And the monitors then need to be interpreted by a sleep physician that has training and can give that patient the proper diagnosis and recommendations.
And then you get it analyzed by a third party. You're not reading this information.
That's right. So my job isn't to read it and interpret it and diagnose the patient. My job is to provide them the therapy that's then recommended based on those results.
Okay, so we have sort of a big announcement here today. We're taking this home sleep test to the next level. Can you describe what Dr. Remmers has come up with?
Right. So I'm very excited about this, and this really will revolutionize oral appliance therapy as it is today to where it will be. And this monitor itself takes what you wore as a home sleep study monitor, and it then allows us to therapeutically assess where that patient's jaw position will be. It will allow us to determine whether that patient is a responder to our therapy, so that we know what to expect as the therapy proceeds. And Dr. Remmers, I'll just let you talk a little bit about the development of the Matrix Plus itself.
Well, thank you. We are launching this from a company called Zephyr, a startup company in Calgary, based upon really very sound science. We've done a 200-person clinical trial and have very adequate and impressive results. Basically, it's the same test that Zach had, with one small addition, Zach. We're going to have a temporary oral appliance in your mouth. And these are upper and lower trays, and they're going to be connected up to a little motor. And a computer sitting on your chest, a tiny little computer that is, will move your lower jaw in and out throughout the night as it becomes apparent that you have some difficulty with your breathing. So it's a wonderful little gadget that amazingly is very well tolerated. We've done over 600 nights of study, very well tolerated, and I hope, Zach, you'll try it in one of these nights.
Oh, so there's no wire connecting the device with the computer. It's all done. How is it connected?
Okay, well, there's the computer is just a small little pad sitting on your chest. It actually talks wirelessly to a tablet sitting at the bedside, and that's that tablet in turn is connected through the cloud to our computers. So then all night long, the little computer on your chest is reading the information that comes from the oxygen probe on your finger, the one you didn't like, and from the airflow measured up at your nose, and then it can say, aha, we have a problem and we should move it. There is a small wire that connects the computer on your chest with the motorized mandibular positioner, the motorized gadget that's going to move your lower jaw in and out. Okay,
so it sounds to me like you're adjusting the carburetor on a car. You're adjusting the airway size to get the optimal flow, right?
Exactly. It's a lot nicer than what I referred to before was when the technician slaps a mask over the nose. If you're going to start CPAP therapy, you're going to first have a 2-week trial with a smart or CPAP, and you're going to be sleeping with this thing on your nose all night, and it's not too much fun. here we're actually just doing a 2-night test in which you just wear this little appliance up against your teeth, and it will move your lower jaw in and out without you knowing it at all. All night long, it'll be moving in very small, tiny steps, 0.2 millimeters, and you will the data will be gathered from that and automatically analyzed and sent back to Dr. Muir, who will then understand, this gentleman is a great candidate, or maybe not such a good candidate. Maybe you'd like to try something else. And in addition, where should we set the mandible? How far should we pull it forward in order to get a nice response?
So, Dr. Muir, I'm guessing this is going to take a lot of steps away
yes.
for you, right?
So one of the convenience to the patient is not only do they know ahead of time what kind of responder they will be to wearing the oral appliance, but it's going to limit or eliminate a number of follow-up appointments where they have to come back into the office, pick up the home sleep monitor, take it home, wear it with their appliance, drop it off, I analyze it, I let them know, no, adjust it a little more, So it's going to go through all of that process using this computerized bite registration temporary appliance. And it's going to tell us what that ideal goal is. Now, one of the things that I can foresee patients thinking is, well, what if it adjusts my jaw
too much?
Four times more than it really should, right? So we determine the extent to which the computer can adjust your jaw forward and back.
So you put the parameters in
That's
before
right.
the test.
So that's something that's done when I see the patient for their records, and when we fabricate the temporary appliance and the bite, is that we program their particular chart with the limits at where we're going to start the appliance position, the temporary appliance, and how far that machine has to be able to move that patient to try and control any breathing events. Now, that's not to say that the computer will use all of that motion. Mm-hmm. It will only use the motion or amount of movement that's necessary for that particular patient in these very small 0.2 millimeter increments. So it's very small, it's very controlled, and it's limited by what we determine clinically.
Now, the device the test is called Matrix Plus.
Matrix Plus.
And when we come back, we're going to continue our conversation with Dr. John Remmers, who's based in Calgary, and Dr. Charnel Muir, the SnoreDentist. I want to sort of just project out where this could go. I'm just thinking in my mind where this might end up. More about snoring, sleep apnea, and how you can find some relief next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.